Thank you, respected chairperson, my fellow panelists, and ladies and gentlemen, very good evening to all of you. And first, let me thank the organizers for giving me this opportunity to be here today and share with you some of the experiences of India in dealing with the demographic dividend as well as the challenges ahead. You know, world is experiencing unprecedented demographic changes during the last maybe 50 years, which will have a far-reaching social and economic and health implications. And 20th century witnessed all that demographic major changes, and India is no exception to that. But India's population grew over more than 5 times during the last 100 years. We started at the beginning of the last century, 20th century, with a 238 million population in 1901. Now, approximately 1.4 billion population, the most populated or the largest populated country in the world in 2024. But also there is a good impact of the fertility decline that has happened in India. In 1950s, when our country started the family planning program, on an average, the TFR, the total fertility rate was around 6. On an average, a woman had 6 children in her lifetime. Now, India has reached the replacement level fertility of around 2 children per woman by 2021 with a voluntary family planning program. So it's a remarkable achievement in terms of fertility decline. But when we look forward to the country's or India's future growth, both economic and demographic growth, I feel there are 2 important demographic characteristics that will decide where India is going to proceed. One is the age structure of the population. You know, every 5th person in India is an adolescent now, and every 3rd person is a youth of 10 to 24 years. So the future of our social and economic development will depend upon what we are going to invest in our education, healthcare, skill development, and even employment promotion. So with a median age of around 28 years, India is relatively a young country and young population, but at the same time, we are also going to face an increasing elderly and aging population. According to the UN projections, by 2050, India will have around 20% of its population as elderly or 60 plus, or what we call it as senior citizens. That will be approximately 320 million elderly in India. That is going to be a big challenge for the governments, societies, and households to handle. So, second important part, coming to this, the gender part. Now, this is usually not received that much attention in our development discourse. Despite many efforts by national and state governments to improve with the various policies and programs, still there are incidences of child marriages and early marriages still persist, and child sex ratio is highly skewed and imbalanced. So considerable gender gap in educational attainment, and particularly in the higher education, though it is narrowing down. But in recent decade, Government of India has come out with a mission program, what we call it as Beti Bachao, Beti Padhao. That means save the girl child, educate the girl child, including many conditional cash transfer schemes to promote the welfare of girls and value of the girls, to ensure that they complete the school education, they get married after completing 18 years of age. And some of the states within the country has shown remarkable progress through these conditional cash transfer programs. Now, in order to reap the demographic dividend, it is not an automatic choice. We need to be prepared and need to do certain things. But there are many countries within one country. The demographic transition varies considerably across various states. I broadly divide them to 3 groups of states. And consequence to this demographic transition, the demographic dividend also varies, the level of dividend also varies among the states. But this demographic dividend will continue for few more decades of the country as a whole due to its large variation across the states and provinces. So recent decade, we have seen a large improvement in the educational levels, and which will improve the skills and employment opportunities as well. So the most demographically advanced states, the fertility is very low, mostly the southern part of India. The major focus is now on aging population, strengthening the social, economic, and health security for India's elderly. And Government of India has also realized this, because in order to have these programs for elderly, we need to have a empirical evidence and database. So Government of India has launched the longitudinal aging study in India, LASI. The first wave was carried out in 2017 and 18. Now we are in the process of launching the second wave, where we are examining the social, economic, and health conditions of elderly population, nationally representative sample, not only the self-reported health condition, but also based on health examinations and a wide range of biomarkers. And we try to follow this panel of 73,000 older adults for next 25 years. Of course, we also need to use other important data sources like national transfer accounts and national time transfer accounts. Government of India's Health Ministry has embarked upon a major flagship program called National Program for Health Care of Elderly, and creating work. So when there is a considerable decline in some of the states, large number of young workers from northern and eastern part of India is coming to the south in search of jobs. And there are opportunities there. So we need to have a more migration-friendly policies in those states. Now, there are other set of group of states, mostly in the central part of India, where the focus should be on education, skill building, and employment generation, and also strengthening the reproductive and child health programs with a human rights approach. Then you have larger states with a larger population in the northern part of India, where they are lagging behind in demographic transition. The focus must be on voluntary access to family planning programs. According to the latest data, even now, 10% of the couple are reporting unmet need for contraception. So that is an important issue to be addressed. Addressing the maternal and child health needs and ensuring universal secondary education for all girls. So this inter-regional population dynamics within the country presents a unique situation that can be turned into a powerful engine for overall development with more region-specific programs and policies. So looking forward, considering India's huge population and the significant demographic diversity, we need to have a differential planning approach required for various states. And evidence from all over the world very clearly suggests that better health facilities improved economic production. So strengthening the sexual and reproductive health program is one of our priority. More investments in girls' education and skill building. And along with the demographic dividend, we also have another dividend called the gender dividend. And in order to harness this gender dividend, India needs to increase the female workforce participation considerably. Now, in the context of South-South cooperation and South-South and triangular cooperation, what can we do in this context? Our national efforts must be complemented with international support and assistance in optimizing the benefits of demographic transition by the member states reducing the digital divide, safeguarding the environment for value addition, building capacities and technology transfer. I think the member states can play an important role in this, and supporting evidence-based data-driven policies and sharing the data collection methods and also methods of program evaluation. And overall, it should be an exchange of sharing the knowledge, skills, and resources among the member countries. And what we are also learning that there is enough scope for learning from the best practices among our countries and sharing those practices in order to improve the lives of our people. And ultimately, our motto is that we are leaving no one behind. Thank you very much for your patience here.